When have you ever seen Africa's bustling cities look and sound quite like this? Around the world, the coronavirus is no longer just a threat. It is a new, sobering reality. And as cities lock down, social distancing is changing the way we live, the way we learn, the way we interact with each other, the way we were. Hello and welcome to Our Voices. I'm Hayley Adams Fitzpatrick. We're broadcasting from our homes to your home. And this week we look at the impact of coronavirus lockdowns on women's health, their safety, and their livelihoods. We know in many homes and communities, women are the breadwinners and the caretakers, and now they are in the front line. In the next half hour, we'll bring you insights from East, West, Southern and Central Africa, and I'll be joined remotely by my co-hosts, Oriane Itangishaka and Ayen Bio.
Hello everyone, as you can see, we're on lockdown here in the US, and later in the show, I'm going to be talking to an expert about women's economic empowerment and about the impact these lockdowns have on women's ability to earn an income.
And I'm going to be speaking to a medical expert about the impact of the pandemic on women's health beyond coronavirus infections, their mental and maternal health, all that coming up.
I'm certainly looking forward to that. First, we take you to a place where people know exactly what happens when a deadly virus breaks out. The Democratic Republic of Congo. And authorities there are hoping that the country's experience with Ebola will help them stem the spread of the coronavirus. Well, our correspondent Anasthasie Tudieshe is in the capital of Kinshasa for us. She's going to take us inside a lockdown that has shut down that city's main commercial hub and shut out many of the people who work there.
Hi, ladies. This setting, me, walking in the middle of DRC's most famous boulevard, le Boulevard du 30 Juin, on any other day would be completely unimaginable. But the area we are in, La Gombe, is on lockdown, and it has been since the 6th of April. End of it, not very clear. 20th, 22nd, we don't know. The impact, though, is very clear. I would see three different ways it has impacted the population. First of all, of course, empty boulevards and streets, except for essential workers. Second impact, psychological. The fact that the virus was discovered in these wealthy areas. You can see a supermarket behind me, but Gombe is also home to government offices and the trendiest places, restaurants, nightclubs, you name them. The fact that the discovery was made here led a certain part of the population to think that COVID-19 is a wealthy people issue, not theirs. Third impact that touches everybody is the economical one, be it in informal sector or formal. But instead of me telling you what Congolese people are going through, why don't we just walk in the streets of Gombe and see what they have to say about the impact of the lockdown on their lives? First of all, security. Let me put my mask back on.
This confinement brings disturbance because usually at this time we already have received our paycheck. They say that shops are closed, that we should be patient, but it's very difficult for us. You leave your house in the morning, your 3 kids haven't eaten anything. They haven't eaten a thing. Sometimes drivers would give us a little something, otherwise we would go home with empty pockets. So confinement is a good thing, but it leaves us deprived.
Anasthasie Tudieshe there for us in the Democratic Republic of Congo. Anasthasie is going to join us again later on in the show. Now, for many women, the coronavirus lockdowns mean days and weeks in isolation with their abuser. Rights activists say around the world they're seeing a rise in domestic violence. I spoke to Agnes Odhiambo from Human Rights Watch in Kenya, and I asked her about the risks to women's personal safety.
It's a very difficult situation. Domestic violence is invisible. It happens behind closed doors, locked doors. Morning, day and night, you're stuck with your abuser in an environment where there's a lot of stress. I was speaking with someone who works at a shelter for survivors of domestic violence in Kenya. And she gave me the story of this 16-year-old girl who was kidnapped by a man And this man stayed with her for 4 days before she was rescued by neighbors and sexually assaulted her. And slum areas are very congested, their houses are tiny. And she was saying to me that this is the discourse in the slum areas now, where men are saying that they cannot just stay in the houses bored, and there are all these women, including girls who are not in school. We are fearing that we are going to see very many cases of domestic violence, of sexual abuse, including unplanned pregnancies for girls. I'm based here in Kenya. Government is taking all kinds of measures. I have not at any point seen them calling out for public participation into what the government should be doing better. That needs to change, and governments across Africa need to hear the voices of women. But I think this is really a learning moment, and we need to learn and take that on board and move with it even beyond the COVID pandemic.
I asked Agnes what her advice is to any woman who really fears for her personal safety, who might be in trouble and wants to reach out for help, especially as cities, neighborhoods and communities are on lockdown.
Violence is a crime, and if you're facing it, you need to speak out and look for help. In our communities, even in these places, in the slum areas, in the ghettos, they always have a social safety network, and so there's a way of reaching out. For example, in Kenya here, we have what they call gender defenders, who are just women within the community who you have their phone number, you can call and say, this is happening to me, can you help me to get out of this situation? And one of the things we are pushing for and asking governments to make sure they do is to treat services for survivors of domestic violence as essential services. If shelters are not enough, just the way they are finding accommodation in hotels for victims of COVID-19, they need to do the same for survivors of domestic violence, because you cannot stay in an abusive situation. It's a very big risk to women's life and to women's health. And whenever there's an opportunity in your communities to be involved in shaping the actions that governments are doing right now, make sure that your voice is heard. Send WhatsApp, send text, call whoever is going there. Make sure that your voice is being heard.
Agnes Odhiambo from Human Rights Watch there, speaking to me from Nairobi, Kenya. And you can also make sure your voice is heard. You can find us on social media. Our handle is @VOA Our Voices, and you can also reach out to us on WhatsApp. The number, as always, is right there on your screen. We want to hear from you as we now open up this conversation. After the break, we're going to look at the link between COVID-19, women's health, and their income. And our hosts are standing by for that discussion. Ayen Biyo, Orion Itangishaka, and Anasthasie Tudieshe joins us from the Democratic Republic of Congo. We're going to break it all down for you. We'll be right back. Stay with us. Being part of Our Voices is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
Welcome back to Our Voices as we broadcast from our homes to your homes during these coronavirus lockdowns that many of us are feeling, whether it be in the United States, in Europe, in countries across Africa. I think for now it's one thing sort of we all have in common. But we want to talk a little bit about the impact of these lockdowns on women's ability to earn an income, especially on the African continent, where all of us here have communities, connections, friends, no matter where we find ourselves in the world, that still is home for us. And so that's what we want to talk about in this segment. I'm joined again by our co-hosts, Orion Itangishaka, Ayen Biyo, and from the Democratic Republic of Congo, we have VOA correspondent Anasthasie Tudieshe joining us as well. Ladies, welcome to the conversation here. Anasthasie, I want to start with you, but I want to ask all of you this question. These lockdowns, as we're all experiencing, what in your view does it reveal about what's right and what is wrong in our societies, and also who gets impacted the most when we have a pandemic or a crisis such as this?
Well, Heidi, first of all, let me say how happy I am to join you. Thank you so much, ladies, for having me. Um, Especially in this particular era, it's really nice to connect and share experiences. Regarding the confinement here in Kinshasa, it does not reveal to me as much as it emphasizes what already is, what we already know. That are three main facts. Number one, the importance of the informal economy. The paid task force here, the paid force here is only 10 to 15% of the population. So people I speak with daily tell me they are starving because this confinement prevents them from getting outside and going outside to get the money they make daily, the little money they make daily, to put food on the table. Second point would be the difficulty the authorities have to reach the most vulnerable. Despite community outreach, campaigns on both radios and TV, and even in the streets. It seems like the more people are vulnerable, the less they think coronavirus can get them. Third point, the importance of women, of course, but we already know that they truly are the unsung task force here.
That's right, Anastasia. This situation really of COVID-19 really have taught the world the most important jobs in our societies. Some of the jobs that many would call low jobs or small jobs, like nannies, housekeeper, elder care, supermarket workers, trash collectors, are actually the people that are holding our society, the fabrics of our societies. We realize that the small jobs are the ones that are holding our societies together.
That's such a strong point, Ariane. And Haiti, I think that this is a really important question because here in the US, the virus has disproportionately impacted Black communities, and it's revealed the racial health gaps here in the US. You take a state like Michigan, for example, Black people account for 14% of the population there, but at one point accounted for 40% of coronavirus deaths. Now, you can make the argument that Black people suffer disproportionately from chronic diseases like diabetes, obesity, lung cancer, lung diseases, which do make it harder to survive the coronavirus. But I don't think it's fair to talk about those underlying conditions without addressing the fact that the health system has historically underserved Black people. And so things like health insurance, things like access to medical facilities has been historically hard for a lot of Black communities. And then of course, there's the issue of food deserts. There are places in this country where Black communities have to travel for miles and miles and miles to get to a fresh food market. If Black people don't have access to healthy food markets, then that might lead them to these diseases that we're talking about. And so if we're going to address this pandemic, we have to also look at the systematic health barriers that have made it harder for Black people to beat this disease in the first place.
This disease, this coronavirus, is really laying bare so many things. Like, as Anastasia was saying earlier, it really just is bringing into sharp focus what already is. And that is that we have in many of our societies across the continent, across the world, there is the inequities that span not just class, but race and also gender. And I think it really emphasizes how women, how the poor are pulling at the short end of the stick, and how broken our systems are. You know, in the United States, we see stimulus packages, we see bailouts and rescues. My worry is for the many women who have been doing these important and these small jobs, who's going to bail them out? And really, I hope this is an opportunity for governments to look forward and see what we need to do for the women in our society, because really they are on the front lines and really could do with some sort of bailout.
I totally agree. Heidi, earlier you had this discussion about domestic violence, and it is something that we can see here, we can witness here in Kinshasa, and it's gender-based violence, but not only, it's also the stronger that will beat up the weaker, because they have to stay together with generally no electricity. We're talking about the most vulnerable. So this is also becoming a problem.
Right. And earlier I spoke to Bukola Onishi from Women for Women International about how these lockdowns are affecting Nigeria's women's ability to earn a living. And she told us exactly what those challenges look like.
Fear, dismay, confusion is what I would describe the feeling of many women at this time. in the country, particularly women in the rural communities, because most rural women earn their living on daily basis. They go to the market, they buy and sell, they go to their farms, they wait for harvest, and then they take their harvest to the market and then they sell. But these days, this is almost impossible. There are border lockdowns, their markets are closed, security personnel are deployed all over the place to ensure that people adhere to staying at home, social distancing, and all that. So it's definitely, and it's been pretty difficult for women economic situation at this time. I know that by the time this pandemic is over, a lot of women would have lost their capital, and then at that point I'm looking forward to what palliatives government would give to support women at this time.
Thank you, Bukola. And what are some potential solutions that can come out of this COVID-19 crisis, especially for women, and also the abilities for government to, support women in times of crises in the future?
One thing that is obvious and one thing that must happen after this pandemic is over is that government must look at the social incentives that we have in the country. So government must look at the infrastructures. We must look at our health system. It was shocking when I read recently that some government officers said they did not know that the state of health facilities in such a horrible shape. But I think this is an high hope now for people that claim that they don't know and they're empowered. We hope that this is a wake-up call for people in authority to appreciate and understand the way people are living in the country. The suffering is huge, the suffering is hard, the suffering is terrible.
Now that was Bukola Onyishi from Women for Women International speaking to me from Nigeria.
Still ahead, how does the coronavirus impact women's health needs? I'll get some answers from an expert after the break.
That's right, Ayan. But before we go there, we spoke to some gender advocates about what COVID-19 would teach us about how to improve women's lives going forward.
Most women depend on their husbands for daily source of income, and in this era where everyone is supposed to stay at home, it would have provided an opportunity for the woman to also bring something to the table. So this is a wake-up call to all gender advocates and all institutions fighting for the rights of women to channel their energy into women economic empowerment, so that even when their husbands are no more, they can still fend for themselves.
Apart from being primarily caretakers and breadwinners for their families, African women are also primary producers in the agricultural sector. The Rwandan government is doing a great job already, but I expect that going forward, there will be even more budget allocated towards this sector, as it has become evident during this COVID-19 lockdown that all other economic sectors come a distant second to food production.
You're watching Our Voices. Welcome back. In South Africa, the coronavirus lockdown presents an unusual challenge for people living with HIV. Those on antiretrovirals have to venture out of their homes to get life-saving medication. This means they are at greater risk of contracting the coronavirus. While healthcare advocates there are looking at innovative workarounds to make sure people get the life-saving medication they need without making human contact. Anita Powell has the story.
South African hospitals are busy preparing for a coming storm of coronavirus cases, which officials expect to peak in September. As they stare down this pandemic, though, they're also dealing with another, even bigger one. South Africa has the world's heaviest burden of HIV patients, with at least 7.7 million cases. Its government also runs one of the world's largest free antiretroviral programs. How, in this age of lockdowns and strict social distancing, can these vulnerable patients stay safe from a new viral threat? Enter the pharmacy ATM. South African nonprofit organization Right to Care unrolled the innovative program in 2018 to give patients with chronic illnesses their repeat medication in under 3 minutes. In normal times, the program saves patients the inconvenience of waiting in long lines at government clinics. During this new pandemic, it could save lives.
The interaction between a patient and the healthcare professional is minimized, is very minimal. It's more or less virtual from the patient point of view because it's via an audio-visual link. So interaction, so the spread of the virus is limited because there is no person-to-person interaction because we're using audio-visual link. We're using an ATM pharmacy to dispense medication to patients.
The program's managing director, Fanny Hendricks, says it could also lift a burden off the nation's hospitals. Patients can get 2 months of medication at a time.
In a time like this, it's important that we decant our chronic stable patients from our overburdened facilities to make way for the side effects of the pandemic.
The program has 5 locations in South Africa, most of them in high-density areas in Johannesburg and the city of Bloemfontein. Most are inside shopping malls, which, under South Africa's strict lockdown conditions that only allow essential trips outside of the home, also minimizes the number of trips patients have to make.
We've seen a rapid increase in patient numbers at our ATM pharmacies. One of the main reasons for this is just remember that these ATM pharmacies are situated in community shopping centers. So in a period of lockdown, patients can easily align the collection of their chronic medication with their monthly or weekly shopping. And also the ATM pharmacies is open 7 days a week. And already we are open 80 hours more per month than the public healthcare facilities.
The program is busy collecting data on how many new patients have entered the program. But they say every single patient they can help contributes to the larger fight against the coming pandemic. Anita Powell, VOA News, Johannesburg.
You know, ladies, as you see there, this is really a risk to so many in South Africa, where, as you may know, we have very high TB infection rates and HIV infection rates. And there is so much concern that this coronavirus, which many believe brought in by people who were able to travel and people who have the means to do so, many concerned that when this does hit the townships, it could potentially be carnage. And so that's why you see health professionals and the President Cyril Ramaphosa especially trying so hard to not just flatten the curve here, but really try and get ahead of it.
That's right. And there's still so many questions about this virus. And I spoke to Dr. Sion Faru, and she's actually on the front lines of this disease, both as an advisor to Ethiopia's health minister and also as a physician in New York, the epicenter of the virus here in the US. And we spoke about the challenges of this virus for women's health. And as you can imagine, there's a lot of questions. Can pregnant women give it to their unborn babies? What about breastfeeding? Is it okay to breastfeed if you as a woman have the virus? I began this conversation by asking Dr. Faru about the impact of COVID-19 on women's mental health.
This burden, especially on women, could even be a lot more because of the added responsibility that women have at their house, right? At the end of the day, after working clinically and after working in the hospital or in the community, they still are expected to come home and to be mothers, to cook and provide for the family. So the amount of burden on women is insurmountable.
Dr. Faru, what do we know about how COVID-19 impacts maternal health? So what do we know about how this virus impacts pregnant women and their unborn babies?
So far, again, based on the studies, and this, again, is a novel virus, so based on what we know so far, like most viruses, and specific with this COVID virus, there's not been any transmission that's recorded from mother to an unborn child, as far as we know. Maybe around delivery time, if the mother is infected and the necessary precautions are not taken, there's a chance that, the newborn might contract the disease. So it's important whether they're delivering through C-section or natural delivery that all the people around the delivery room or the operating room take the necessary precautions. But so far, from what we know, the transmission from mother to an unborn child, the risks are very minimal. And even after birth, the decision comes on whether they're breastfeeding or not, and if the mother is infected. And of course, we know that a lot of the immunity is obtained through breast milk for the child. So if the mother decides to breast milk, it's important that they, especially if they're symptomatic, to cover their mouth with masks and to ensure that they take universal precautions that you'll take when you're infected and to protect others.
When a woman gets pregnant, obviously her body goes through a lot of changes. How did these changes in pregnancy impact a woman contracting COVID-19?
So in general, what we know from other studies and before COVID-19, women go through different changes that puts them at a higher risk of acquiring infections. And some viruses like influenza could be more debilitating to pregnant women and expecting mothers, and the consequences of that could be more deadly for pregnant mothers. So usually from other viruses, we've learned that because of the immunity level is a little bit lower when compared to the general population. So it's very important that pregnant women take the necessary precaution, but maybe take also extra precautions unless you have to leave the house, absolutely not leaving the house, and also decreasing the risk. For example, if your partners, for example, work in a hospital or essential workers, that you start isolating before they show symptoms.
And that is where we will leave it. Thank you to the many voices who contributed to our show this week, and thank you for watching. We're going to leave you with something a little uplifting. This song from Bobby Wine, Ugandan political activist and singer. This is Coronavirus Alert. Thank you for being with us. We'll see you next time. Go well. Goodbye.